If you are gaining weight in your 40s or early 50s and nothing is working, no matter how clean you eat or how many miles you walk, you are not imagining it. Hormones are shifting, estrogen is dropping, sleep gets worse, stress climbs, and suddenly fat seems to relocate, especially around the belly. Welcome to perimenopause. Now, here's where things get interesting. Some women are finding that microdosing Tirzepatide, the same drug used in full doses for diabetes and obesity, might help ease some of this midlife weight struggle. But can a low dose really make a difference? Let us talk about what is actually happening in the body first. During perimenopause, declining estrogen levels disrupt insulin sensitivity. That can lead to higher blood sugar, increased fat storage, and stronger cravings, especially for carbs and sugar. Sleep disturbances and cortisol spikes only make it worse. GLP-1 medications like Tirzepatide help by improving insulin sensitivity, reducing appetite, and slowing gastric emptying. But most studies use full-strength doses, 5, 10, even 15 milligrams per week. So why are some women trying just 1.25 or 2.5 milligrams? Because they do not want to lose a ton of weight. They want to regain control. On Reddit and in Facebook groups, women are sharing how microdosing helps them feel more stable, physically and emotionally. One woman wrote, "I do not need to drop 30 pounds. I just want to stop gaining. Microdosing let me hit pause." Another said, "The big doses were too much, made me tired and foggy. On micro, I can eat less without feeling like I am starving." There is no clinical guideline here. This is all off-label. But the idea is gaining traction, that for perimenopausal women, even a whisper of GLP-1 support may be enough to blunt cravings, lower insulin resistance, and stop the gain before it turns into more. Doctors are starting to notice too, especially in functional medicine and concierge clinics. Some are prescribing compounded Tirzepatide in ultra-low doses for metabolic reset, particularly when other interventions have failed. Of course, it is not magic. Microdosing does not replace strength training, good sleep, or balanced meals. But for some women, it is the missing puzzle piece. Could it be right for you? That depends on your goals, your symptoms, and your relationship with food. Microdosing is not for everyone, but it is a conversation worth having with your provider and maybe even with yourself. In our next video, we will ask whether microdosing Tirzepatide affects mental clarity, because several users report not just appetite changes, but mood lifts and less brain fog. If you are in perimenopause and have tried microdosing or are thinking about it, we would love to hear your story in the comments. Your voice helps someone else feel less alone. Make sure to subscribe so you do not miss what is coming next. You are not crazy, you are not lazy, and you are not alone. See you soon.